You're watching EAC News. Thank you for joining us. The World Health Organization in the Western Pacific region says border controls and closures are not possible to maintain for a long-term period. WHO Regional Director Dr. Takeshi Kasai was speaking during Wednesday's virtual media briefing. He says vaccines and a risk-based approach in every country are the keys to reopening borders. In his opening remarks, he expressed admiration for a 108-year-old Cambodian woman who chose to get vaccinated. He added that the royal government is trying its level best to manage the situation along its borders, with Delta cases on the rise. EAC News reporter Reo Soko attended that conference.
The WHO in the Western Pacific has noted that Cambodia's current challenge is land border control. WHO Regional Director Dr. Takeshi Kasai says that Cambodia is trying its utmost to manage borders, routing to Vietnam, Thailand, and also China. He has emphasized that with rising Delta case numbers, many countries in the Western Pacific are enhancing border controls with travel restrictions, but says keeping these border controls in place for an extended period is too costly and possibly unreasonable.
We don't know actually exactly when the border can be fully open, but what we know is that depends actually on what action we take. And so the best way to get there is to stay the course and use the knowledge we have from experience shared from other countries, and use all measures we know it's effective. Vaccine, public health and social measures, and also a border control, continue to learn and improve, and also strengthen the health capacity. Make that as a combination.
While Cambodia is mixing AstraZeneca vaccines as booster shots for Sinopharm and Sinovac, the WHO has advised all countries in the region to provide the same vaccines as much as possible.
There were no clinical trials that were undertaken for the mixed and matched vaccines. While we were rolling out the vaccination and in the context of the constraints of supplies, other countries have considered mixing and matching vaccines. And we know that some countries, including the UK, have used AstraZeneca as the first dose and Pfizer as the second dose. And with the very limited data that is available, it seems that this combination is effective and also safe. However, aside from that, we do not have studies to show that other vaccines can also be mixed and matched.
Dr. Kasai recalled his video call last week with a 108-year-old Cambodian woman who chose to get vaccinated. He says he was inspired and motivated by a woman who chose to get vaccinated to be able to protect herself and others in her community. Rhea Soko, EAC News.